Kelly, thank you for joining me on this call.
So tell me all the things.
Okay, so I've been on a bit of an airway journey. I found Jaw Hacks, Ron's channel,
Yeah.
probably over 2 years ago at this point, and I kind of came to the realization I needed some sort of orthodontics again after I went through Invisalign from ages 14 to 19, around 15 and
Oh,
19.
okay. So let me ask you this. Where do you live, or where did you go through orthodontic treatment? Like what
So
state?
in Pennsylvania, so I'm in the Philadelphia
Okay.
area.
Okay. So it's interesting, like my background working in ortho and pediatric dentistry, like there are significant treatment differences based on where you live, which is like what I'm seeing too when I work with these clients. So how old are you, if you don't mind me asking?
I'm 23.
Okay. So like when you had the Invisalign, there was a lot of talk about like the right candidate for Invisalign, and it was really not thought that a lot of people were the right candidate. So I'm wondering like what your occlusion was then, Cannon.
Yeah, I was very oblivious and I just knew, um, I was told I needed braces.
Mm-hmm.
I went to an orthodontist probably around 12 or 13, and they didn't want
Mm-hmm.
to straighten my teeth, but
Mm.
I had very like buck teeth in a V kind of
Oh,
V
V
shape.
arch. Yeah.
Yeah.
Okay. Interesting. Okay.
And I do have, or I do have a high vaulted, narrow-ish palate.
Mm-hmm.
Yeah.
And did you know that then?
No, I found that out after watching Jaw Hacks and then asking my dental hygienist. I was like at the end of an
Mm.
appointment, I was just thought of it and remembering one of the videos I watched on YouTube. I was like, "Do I have a high vaulted palate?" And we were walking out of the room, or I was in the waiting room. She brought me up to the
Mhm.
front desk for my next appointment. And she looked and she was like, "Did you have a binky as a kid?" Or, and I don't remember, but
Yeah,
asking me
you
if I was
wouldn't.
breastfed. Yeah.
Mhm.
So that's where all these puzzle pieces started coming together. So I was noticing
Mm.
relapse from the
Yeah.
Invisalign. And I loved how my teeth looked after the Invisalign, but
Okay.
once because they look straight, right? It
Yeah.
was camouflage orthodontic, so it was all looking okay. And I guess it was kind of a vanity thing. And
Mhm.
I almost got one of those Smile Direct Club
Yeah.
things just to,
Yes.
yeah.
Ugh.
And then I kind of went even deeper and realized this was more of a jaw problem.
Yeah.
Um,
Good for
so that's
you.
how I found Jaw Hacks
Yeah.
and eventually Dr. Mariana Evans out here in Newtown Square, Glen Mills, PA area.
Mhm. Yeah. Well, she's actually coming here in July. So
Oh,
I'm
no way.
gonna like the hot no June, late June was like the hottest time you can come to Phoenix, poor thing. She's gonna like hate life. But I also have to say, like, Philly accents are my absolute favorite. Like,
Oh, really?
I love a Philly accent. Like, did you watch? I'm sure that there was like two shows on HBO.
Mhm.
One was like Mayor of Easttown.
Yeah.
Did you watch that?
I've seen clips. I haven't watched
Oh,
it, but
okay.
it's very
It's more for
popular with
like
my
old
friends.
people. And then
I
there was
have,
like that other one. What was
um,
it called? With
oh,
Mark
wait.
Ruffalo.
Yeah, it's blanking on me. They shot it in the warehouse I work at
Yeah.
now.
Oh my
Yeah.
gosh. I
What was
gotta
it?
tell my husband.
It starts with a T, right?
Yeah, it's like I don't even have
Um,
hold on. I gotta
oh
look
my
because it's
God,
gonna
it's
drive me
right.
nuts.
Yeah, it's right
But
there on the tip of my tongue.
the way that they talk is like I love your accent. So I could hear it on your one.
So it's probably
Sorry.
a bit unique because both of my parents are from New Orleans, Louisiana.
Oh, really?
Yeah,
That
so
is so cool. And those are like two very distinct American, you know, what's the word? Like regional accents. Very
yeah,
distinct. And you had a blend of the both.
a bit. I don't know
Wow.
if you could tell just being in the field, but there's some words I have the New Orleans,
Uh-huh.
like I lean
Uh,
that way.
okay. Do you know like some of the sounds? Because I'm not as familiar with the New Orleans one.
It's really like I need to hear it. So I worked at a grocery store growing up. That was my first job. And the
Uh-huh.
one day we had two people come through the line, and I just could instantly tell from their accents they were from
Really?
New Orleans. And I asked them, and I was correct. But it is a
That is
very
so cool.
distinct. It's so distinct, and yeah, it's crazy.
Yeah, there's a guy on TikTok, you probably follow him, and he's a sorry, my brain is fried. It was a long day, but he's a linguist, and he can tell where you're from, and he'll guess where you're from based on your dialect. You should reach out to him and say, "Hey," because people will say, "Hey, can you guess where I'm from?" That would be very interesting.
Send me his profile.
I will. Okay, Task. That's the
Task.
show.
That's it. I knew it was a
Task.
T. Yeah, I
God, that
haven't.
was a good show.
I'll have to watch those too. Yeah, that was filmed in the warehouse that the company I work for just acquired, and that was like our big fun fact when we bought it or rented
That is
it.
so cool. That is so cool. Yeah, I love all that because there's like your own little, cultures and stuff. Here like in Phoenix, people are so because it's such a new city, there's so many different people from all over the place. I was born and raised here, so we don't really have like our own little culture, I would say, or accents or anything. But anyway, we'll get back into the airway talk. Sorry.
Yeah, no. Yeah, so I wanted to talk to you because I was seeing all of your videos on
Hmm.
TikTok, and I love how you focus on children and
Hmm.
providing them with the right tools so hopefully they never become a patient of someone
Yeah.
like Dr. Evans,
Yes.
because early intervention's the best intervention. So
Absolutely.
from what I'm learning, and of course she treats children and adults, but if you don't need the expander in the first place, it's probably best if you can
Yeah.
do
Yeah.
everything naturally. And it's so hard with pollution, with the lack of knowledge, with the
Hmm.
introduction of soft foods at such a young age, which I'm pretty sure I suffered from,
Yeah.
and lack of breastfeeding. Those are the three
Hmm.
main ones that Dr. Evans tells me about. But okay, so the first thing I wanted to bring up was a speech therapist I had in second grade, and
Oh.
she told me, her name is Miss Mitchell. She told me proper tongue posture is having
Uh-huh.
your tongue on the roof of your mouth,
Yeah.
and that flew over my head at the time, and I didn't listen. But
Because you
I've
were what, 8?
Yeah, super young and
You
didn't
don't
understand.
care.
No, I wanted the scratch and sniff stickers and to
Yeah. Yeah.
get back to recess. So I'm wondering, is that true? I'm gonna asking you that question because that same dental hygienist that I asked about my high voltage palate, she was like
Yeah.
gaslighting me and telling me that was not proper tongue posture.
You're
So
so funny.
I want to know, like,
So,
from the horse's mouth per se, like
mhm.
what is proper tongue
Nay.
posture?
So let me go back. Let me go back a little bit. So, like, my kids are your age, and I had my kids really young. I was 19, 20. And what I could say about probably what your parents, like, what was available and not available to us at that time. So, this is like late 90s, early 2000s, and we did not have food pouches. So those like little sucky sucky applesauce
Mhm.
babas. We didn't have those. Sippy cups were all the rage. Like when you
Yeah.
guys were little, sippy cups was it. Like you were not a cool kid if you didn't have a sippy cup. And like God forbid you go out on the town for play dates and you didn't bring a sippy cup. So, since you guys were little, I think the generation right before you, there wasn't sippy cups. So that's interesting. Check.
Mhm.
And then the other thing that's changed, also like being a parent, but also being in pediatric dentistry, we didn't know like early intervention. We didn't know, like, it was more or less come in, get your kids' teeth brushed by 4. By 4. This was the talk back then. It wasn't 1 like it is now. So imagine the craniofacial growth from 0 to 4 with non-nutritive habits. And please let me know if you don't understand anything, because to me, you're like an expert. So if there's
No, far
words that
from it.
I'm, well, you're doing a great job. But if there's words I use, just like let me know, because I know your audience too might, may not know some of the terminology, but I'll try to speak layperson as much as I can. But 0 to 4, you have non-nutritive habits like pacifier binkies. That's what your hygienist was gaslighting you about, and sucking fingers and digits. The pacifiers that we see in the world now are different than what was available to us. It was like these big old chunky, like, oh, like it was ridiculous. The other thing was we used a lot of containers to put our children in. So I don't know if you remember your parents talking or you seeing pictures of you sitting in a
Yeah.
bouncy seat.
Yeah.
hmm And there's also the Johnny Jumper. Were you in a jumpy that was hooked to the door and stuck you in there and you just went to town and bounced?
I've seen those for sure.
Okay.
And would
So
playpens kind of fall into that or not really?
kind of, it depends on what they stick in there with you.
Okay.
So we're going back, right? We're going back from 0 to 4. um, Relevance here is we weren't seeing anybody besides a pediatrician. If so, there wasn't other holistic options. There wasn't support for breastfeeding. So I tried so hard to breastfeed my kids. I was in the army, and even having access to care in the military at a medical training hospital at Tripler, Hawaii, it was good luck, sorry, and stop crying, because I was crying because it hurt so bad. And so knowing now, my son's 26, tongue tied, daughter pacifier until she was almost 5.
Wow.
And yeah, so talk about gaslighting. And now she's a speech therapist. So it all works
Oh my
out.
gosh, that's
Um,
awesome.
yeah, but so that young population that these other individuals that I see that are that are really enjoying Ron's content and seeing that they have an issue, that's what you guys grew up with, not at the fault of us as your parents. We didn't know any better, and there wasn't anything like there is now in social media, and you and other people paving the way to get the word out there. So that's why, this is my why, is I don't want kids to have to go through what my kids have gone through. They're not at the level you are, Cannon. They're like, oh, I guess I'm okay, even though they know what I do. And then seeing other young adults that, especially, girls have it a lot harder because of our hormones, but our mental health is, when we are at your age group and we're not sleeping well because our jaws aren't the size they need to be, it really does damage to how we feel about ourselves and anxiety. And I'm sure too that may have been something that you experience or other listeners experience, because if you have a narrower airway, you have to work really hard to breathe. When you work really hard to breathe, your mind thinks you're in fight or flight, so your world's a threat to you.
Right.
So we need to get to these kids earlier. So thank goodness the American Academy of Pediatric Dentistry has changed their guidelines. They want everybody to be seen by a dentist at 1. Does that mean all dentists know about airway? No. Most don't, I would argue. They did change and update their best practices in 2024. And they do have a big paper about craniofacial growth, warning and red flags, and the referral hierarchy to be including an ENT, sleep physician, and myofunctional therapist. So, yay! But you have to read it. You
Yeah.
have to read that paper. So that's where I've seen things change in the last, you're 23, in the last 20 years, I would say. And I have the power of having this little box of technology to tell the world about how important it is, moms and dads and kids and brothers and sisters and aunties and uncles. Like, if you see your younger loved one with their mouth hanging open, please just at least give them a little heads up that that's not normal. And I would love to know for you, when you were watching Ron's videos, because I am curious, did you relate it to this is where you can help me with this. Are you speaking collectively as a whole, your age group, young men, are you guys looking at this? Because my husband's in a MARPE. He's
Yeah.
49.
I saw one of the videos you made for him. I thought that was so cool.
Yeah, it's oh ho ho. That's the other thing we could talk about, how much more it costs at his age, health
Yeah.
and all the things.
Hmm.
But are you like, was your initial motivation aesthetics, or were you relating to some health issues? That's my big question.
So I'd say 50-50, right? So I didn't really know I wasn't looking quite right. You always kind of know, and I've talked about this in my past videos, where, in my opinion, because I wasn't developing properly, you're
Mm-hmm.
treated different. So people have probably heard of pretty privilege, or you get
Mm-hmm.
treated better if you have, like, I guess, if you look better. So I kind of always felt like I wasn't getting that attention as like a 5, 6, 7, 8 year old in preschool or
Mm-hmm.
whatever. And that probably
Mm-hmm.
led to behavioral issues. And then young boys also are more rambunctious as at that age. So, but I remember a kid in the grade below me at summer camp just getting like all this attention because of how he looked, and then thinking like, oh my gosh,
Interesting.
what is going on here? And then I'm not connecting those ideas until like today, or the past couple of
Yeah.
years.
Yeah.
So yeah, I'd say 50% aesthetics, and then we can go back to the functional issues in my health.
Mm-hmm.
I've struggled with insomnia probably most of my life,
Mm-hmm.
and I have been using, or I have used sedatives in the past.
Oh man.
I chronically was like a user of melatonin
Okay.
growing up. So I know I wish someone would have told me to stop, because that's actually a hormone and it can
Mm-hmm.
disrupt certain things. So all throughout sixth, seventh, eighth grade, high school, using melatonin, and then discovering Tylenol PM, which was great at the time,
Oof.
but probably
Can
great for sleeping. Yeah, go ahead.
can I ask you? So, as a parent hearing this, I the one thing I did have was my medical and dental background, and my mom also being in medical. To me, I'm like, oh, you had melatonin when you were that. So, like, tell me about the dynamic with your parents and what you were going through, and how that worked out. Was that something you guys had a discussion about, or?
Yeah, so I believe it was just bringing it up to my pediatrician, saying he's having some
Mm,
trouble sleeping, and they just said, "Go
okay.
try this, try melatonin."
Okay. Okay.
Um, and knowing what we know now, it's probably not the best thing to be giving someone that age.
Yeah. Yeah.
Um,
Okay. So
getting
your
yeah.
parents took you to a pediatrician. They're like, "Hey, my kid needs help. He can't sleep."
Yeah, well, maybe not for that, but in like the yearly checkup, it would
Okay.
be brought up, and
Okay.
yeah, there was some nights, I mean, I wouldn't get to sleep until like 3 o'clock in the morning, and then going to
Mhm.
school the next day. And then, of course, like being on YouTube, watching Swoozy, if you know who that is, watching those animations on YouTube, like that definitely didn't help. But yeah, so sleep is always something I struggled with. So I'd say it was like aesthetics, sleep. I could never clear my when I would get sick as a kid, I
Mhm.
would get so congested and so aggravated about that my mom would buy all the Vicks vapor rubs and the humidifiers with the drops in them to try to open up the
Mhm.
chest rubs as well. And then as I got older, at the end of high school, I started heavily leaning on cannabis to sedate me for sleep, and I like
Mhm.
fell in love with that because of how easy it was to fall asleep with
Yeah.
that. And then realizing that that's not a long-term solution, trying to get off of that and experiencing nausea and such,
Anxiety.
anxiety.
Yep.
I was prescribed promethazine in the tablet
Mhm.
form
Wow.
for
Wow,
nausea,
wow.
but I quickly learned that that is a sedative and that
Yes.
it was like great to take, great in my mind to take before bed, to kind of like wind me down and pass out. But I always knew that it wasn't the fix; it was a band-aid because, as you know, but people listening
Mhm.
might not. Promethazine, it you wake up feeling groggy basically, and it as well as marijuana or cannabis, so you can wake up feeling groggy from that as well, and
Mhm.
it messes. Oh,
This is Wally. He
hi,
naps it.
Wally.
Sorry, they're fighting right now and like well, they're play fighting. And so they're just I don't know if you guys can hear, but I'm trying not to let them go crazy. And then this is his sister Pinky. Because my
Oh.
kids are also gone and so I had to take care of something.
Oh, so cute. We can't hear them at all. That's good.
Okay, good. Okay, good. Sorry. So promethazine, what's interesting, Cannon, is we used to use that to sedate the kids to do fillings. Like,
Wow.
yeah, you'd mix that with other things, but the fact that you were taking that as a prescription for nausea is mind blowing. But you don't know what you don't know.
Exactly. Yeah. So that's an antihistamine,
Hmm.
can be used for nausea and sleep, apparently.
Yeah.
So yeah, I was using that cannabis at the time and waking up still feeling like crap. So it was
Yeah.
helping me get the sleep, but the sleep quality wasn't very much improved. And then I wear an Apple Watch, so I
Hmm.
was able to track that my REM was kind of crap and my deep sleep. And it's debated like the accuracy of these things, but
Yeah. Yeah.
my
But
deep
still,
sleep
it's
was,
something.
yeah, it's something. So my
Hmm.
deep sleep was like 30 minutes a night. It was like horrible. Um,
Hmm.
and it could be a variety of things. It could be mold toxicity, it could be the
Yeah.
cannabis, it could be the promethazine, whatever else is in the environment. But that led me to Ron's channel, connecting the aesthetic part of it. And I honestly didn't think I needed MARPE until going
Yeah.
to Dr. Evans and then actually looking at my airway and seeing like, okay, there is something wrong here and it should be addressed.
And like, how lovely is that she's there, like that just lined up so nicely for you, to be honest, because when I see clients that are not local to me, that's the hardest part is to connect with somebody that has the wherewithal like Dr. Evans. She's a periodontist, which is I don't know if a lot of people know that she's a double board certified periodontist is a gum dentist. So she specializes in the disease of gums, gum tissue, the health, and systemic health. And then on top of that, she also specializes in orthodontia, which is amazing. So yeah, very like I'm jealous.
I was so Ron said, I've said it in my past videos, but he told me in my consultation with him, because I paid for a consult with him to kind of point me in the right direction. I
Yeah.
didn't even know Dr. Evans was 15 minutes down the road from where I go to college and where I'm living.
Oh my gosh.
So she was right in my, so he said like the sensei or the teacher appears in your backyard when you need them most. And that was like,
Sorry. That's
yeah,
funny.
it's hilarious. So I went and I got an appointment with her. We saw my airway with the CBCT, the 3D X-ray that looks at
Mhm.
everything. And she was like, yeah, you need it. I didn't really know who she was in the
Yeah.
level she's at, because she's
Yeah.
probably one of the top,
Presence.
yeah, the top
Yeah.
people
Yeah.
in the expansion field, in the airway
Mhm.
field. So of course all the things were going through my head, like, do I really need this? All this stuff. And I she has 2 interviews with Ron on his channel. They're
Yeah.
both like an hour long, but I watched them multiple times before
Yes.
putting the down payment for the MARPE. And
Ugh.
I was just like, oh my gosh, like this, she knows what she's doing. She's highly respected, and
Yep.
I'm not getting scammed, basically. And that's also been a hard thing for me, is my parents didn't want to accept that I needed like another round of orthodontics, especially my
Yeah.
dad, who had paid
Yeah.
for the ones in the past. And he's like, oh, you're basically going to be undoing, or shelling out all this money for
Mhm.
orthodontists again. But yeah, it's like I needed this.
Good for you, Cannon. Look at you, 23, taking a hold of your health and all the things. Like, that's pretty amazing. So you do have to like pat yourself on the back, because to have that much motivation to say, to be introspective and say, I need this. I want to do this. And then on top of that, it's not cheap. It's a huge, that's, it's like a huge undertaking. And it just goes to show, like, you were at a breaking point probably, and you said, I really need to do this, and it made sense to you. And so um i I really admire, very admirable of these young adults such as yourself. Ron's more unk, but like you're definitely allowing other young men to see that this is something that they should take seriously. It's like your dad, how can I ask you how old your parents are?
Sure, they my mom's late 40s and my dad's early 50s.
Okay. Yeah. So their generation is a little different. And, they probably didn't, either they didn't have braces or it was more of a cosmetic thing. And
Mhm.
I didn't know that. So, like, my mom's from England. And so I would have cousins that would come over and they would ask me when we were little, why does everybody have braces over here? And I'd be like, you guys don't have braces? What? So, that time frame, it was more for aesthetics. And I think you guys are going to be that transformative era and say, hey, this is for our health. Like, we're taking this on because we want to take ownership of our health. That's why I named my practice My Myo, as myo means muscle in Greek. My Myo, I'm taking ownership of myself, my body. I am looking to have people on my journey to help me, because
Mhm.
that's what Dr. Evans is. She's like your sense. How did he say it? Because that's
My
really cute.
sensei, yeah,
Sensei.
sensei in the backyard. That's she's
Yeah.
yeah.
It's very Beverly Hills Ninja. So, like, sensei in the backyard is like allowing you to unlock this side of you that you would have never encountered. And if you did, like, with sharing my husband's story, this was all, this happens to you guys when you're little. Like, you started to have probably some nasal congestion. Do you have any memories of being congested or getting sick frequently when you were younger? Like upper respiratory stuff?
I did have constant ear infections as a child. I'm not sure if that's
Oh,
connected. I had the tubes in
yes.
my ears. I
Can
had
I
my
tell you why that's?
Yeah,
Connected?
please, please.
Okay, so you have a muscle and that runs in the back of your throat called your tensor veli palatini, and it looks like little levers, and it goes doo 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 doo, and it's connected to your middle ear, and it drains your eustachian tubes. And so
Wow.
if your tongue isn't posturing up with pressure, and you don't swallow like you're swallowing with the back of your tongue to push up those little levers, then your tubes aren't going to drain. The
Wow.
other thing that we know is there's higher levels of collapsibility. Um, and do you know that's the other thing that we look for in our clients is, is there any hypermobility in their family? Have you been screened for hypermobility? Also, neurodivergence. It's very common to have ear tubes, which that was me. I had multiple ear tubes. So it tells us that, hey, Cannon's little tongue there wasn't doing what it should have back when you got all these ear infections. And then you're on antibiotics frequently. And then that does stuff to the bone density, and that does stuff to how your mandible lays down and all the other things. So that's pretty crazy.
Wow. So I didn't even know that until you explained that was a direct connection. Um, yeah, so you're gonna take a minute to process
Yeah.
that.
Sorry, I
Um,
didn't mean to lay it on you.
no, this whole journey. I'm learning so much. So I had the privilege of attending one of Dr. Evans' courses in treating
Nice.
kids under the age of 6. So
Nice.
the first time I attended that course, I've only been to the second day just because she does it on a Friday and Saturday, and
Yeah.
I work full time.
Yeah.
So, but she had a list of symptoms up on the board, up on the presentation screen, and one of them, which I struggled with as well, was incontinence or bedwetting up
Mhm.
into a certain age. And of course, like that's something super like you don't want to talk about that like
Yeah.
normally.
Nobody
Um,
does.
but once like I'm sitting there listening to this because I got the MARPE placed and I asked,
Mhm.
"Oh, I saw you're doing a course on her social media." I was like, "Can I attend?" Just because I was interested in it.
Yeah.
She invited me very generously, and hearing that, I almost started tearing up because that's something I
Oh,
struggled with so much as a kid. My sister's like making fun of that, like kid
yeah.
shit, but it's like, yeah,
Yeah.
that has an effect on like someone who was supposed to grow out of that a long time ago. But for some reason, I was just waking up almost every night, like wetting the bed and learning that had a connection to my airway was really
Yeah.
the first eye opener to okay, this isn't just for aesthetic purposes. I actually was experiencing like these symptoms, and allergies were on there too, and I've had
Mhm.
those, but that was the first one that was like a punch in the face. Like, oh my gosh, I didn't miss out because this is such a new field, but it's like I've struggled so long and not known.
Oh, Cannon. I know I get emotional because I am such an empath, but also as a mom, when kids come in and uh, they trust me enough to tell me, I really want to spend the night at my friend's house and I can't because I have a secret, and it becomes like their secret. So, you know, parents and other peers and family members might think, "Oh, whatever. It's kid type shit." But when you look at it, what does it affect them emotionally and how long? How long does it stay in you? Because the body keeps score. I reference that often. Your body physically remembers that and how it felt. And so you having a visceral reaction is like it breaks my heart because that's why I'm so passionate, is because these kids don't know it. They don't have the resources. But if you were to ask a child that wets his bed and say, "Hey, we can help you," and it's usually boys, "Hey, we can help you," they would in an instant say, "Let's do it." But their parents
Mhm.
don't know, or they go to the pediatrician and they're told they'll grow out of it. And then you
Mhm.
look in their cart at Walmart and they're size 24 extra wide goodnight pull-ups with this boy that's 12 years old. And so
Yeah.
like, right now I have 3 clients that are in their late teens that are still bedwetting. Like
Wow.
crazy, right? So, and this is the first time they've ever heard this. So like this is where it gets personal for me. Like I don't want to see a child hurting. I don't want to see a child hurting, whether it be emotionally, physically, and this is really where we have to be more thorough and discuss this more and have referrals for this situation, because imagine that you had some intervention at that age, like
Hmm.
what that would have done to your self-esteem and your mental health and all the things, because that's what I'm hearing from you. So
Hmm.
I really appreciate you sharing that with me, because it means so much, and I think you're speaking for a lot of other people too. So I'm just so glad that you were able to go down this rabbit hole, if you will, that you'll never get out of.
Right. Yeah. No, we're too far down.
Now, do you think you'll, because I did look at your info, I thought I saw something with geography as your study, course of
Yeah.
study?
So my undergrad was international business and
Nice.
management. So I have a dual major, and I've always loved maps as a kid. So
Hmm.
um, my college, Westchester University, had a geography department in GIS, so
Oh,
Geographic
yeah.
Information Systems.
Yep.
So I'm in an accelerated grad program for that. Fingers crossed,
Cool.
graduating this May.
Yes, you will.
Um,
You will. You're
so
graduating this May?
yes, from grad school.
Oh, wow.
Yeah,
Congrats, congrats. And
thank
so
you.
what field will you go into with that?
We'll see. There's all the job market's tough right now. It's like the cliche thing,
Yeah.
but
Yeah.
I have a full-time job right now, so luckily it's like I'm doing
Okay.
good, and I'm like, staying the course in that career because it's paying for the MARPE and all this
Yeah. Yeah.
health stuff that is so
Mhm.
expensive.
I know. I know.
Yeah. So I'm in the exhibit industry right now. So trade shows,
Okay.
and the company I
Okay.
work for does that. It's very business to business.
Yeah.
Hopefully, I can transition into maybe a government, state or local, possibly federal. I wouldn't like to do that, to be completely honest. I'm more interested
Yeah.
in the business side of things, and
Yeah, of
per my
course.
undergrad, yeah.
Yeah. Well, good for you, Cannon. You really have it going on over there. So keep it up. Keep it up, because like I always tell everybody, I had, with the airway thing and all the consideration, I didn't fall into this until I was in my mid 30s. And
Mhm.
so for me, this was pivotal in my health and my mental health and all the things, because very similar to your story. I wet the bed. I had tonsils and adenoids out and tubes and all the things, and you just kind of get by because nobody stops you to say, "Hey, this isn't normal." Most people don't that you go to see. They just kind of feed you, take this and do this and take that and do that. And so with being in dentistry, I sat in a course and I was just like blown away that we are all not talking about it. And I think that's how it hits all of us, is just we're just blown away that this is a thing, and but it's not well known and you have to really work to find out more.
Yeah.
So that's where it led me, and it was like how you got emotional. It was me too, because I was like, wow, this could have helped me. And my kids are kind of too old now to listen to, to like listen to me, but this could have helped me as a new mom. And then thinking about all my patients and, yeah, and you kind of get like you get sad, like you feel guilty. And I'm sure other providers feel the same way. You just feel guilty, like you missed something, but we're trying our best and we
Mhm.
want to help so many people. So like this has changed my life. I'm sure it's changed your life. It's changed my husband's life. I don't know if he would still be here, to be honest, if he didn't take his sleep seriously. Like watching him go through what he did with his heart in front of me and having him take him to the hospital because he had sleep apnea, that nobody cared enough to really motivate him to do anything about it. We don't understand it. So that's why we're on these platforms, because we want people to understand this and see the value in it, and hopefully it'll help save lives.
Yeah,
So that's
exactly.
that's where that's where we're at.
Can we go? You brought up your husband. I want to
Yeah.
hear, and I want the audience to hear a little bit about that story, his story.
Yeah.
We'll start with the adult side. How much time do you have, if you don't mind me asking?
I could probably do another 20 if
Okay,
you're
perfect.
okay.
Yeah,
Yeah.
that sounds good. So let's
Okay.
do his story on adults, and then since the parenting and children aspect is so important, after that,
Yeah.
to wrap it up, maybe you can give some things that parents can look out for,
Absolutely.
early intervention tips.
Okay, cool. Cool. Yeah, so, with my husband, I met him, I think it's 15 years now, and I noticed that, and I hadn't been around. I'm trying to think, like, when you're around something a lot and it just becomes normal. I
Mhm,
wasn't really around snorers. So that was new for me. And he was tired all the time. And I was like, oh, it's because he works shift work. And that's a whole other episode. But shift work is not great. So, we were going by and you start dating and you're like, oh, let's go have fun. But he was like always tired and always needed energy drinks. And I just, noticed, filed it away, noticed, filed it away. But then it kind of like, got in the way of enjoying things, and, like, oh, too tired. Oh, let's go get some energy drinks. And that just became like your way of life, because you
mhm,
think that's how, I don't know, you don't know any better, I guess. And so, time goes on. The other thing is, certain people don't have access to care. Some people don't have their parents that have a lot of wealth of medical knowledge, different socioeconomic backgrounds. He's Hispanic. He grew up in a lower socioeconomic group, if you will. I did too, but my mom was a nurse, so of course things are going to be prioritized different. His mom and his family had no medical people in their family, so different things are prioritized, right? So
mhm.
time goes on, he grows up, he meets me, I'm in dental. I'm like, come on, man, let's do this. And so we, got teeth looked at and things like that, still not aware of the airway connection, right? So time goes on, then I fall into the airway rabbit hole and I'm like, oh, this is it. This is it. So he gets a sleep study. He stopped breathing, what, 60 times an hour? 60 times an hour. That's a lot. That's a
Mhm.
lot. And starts blood pressure high. Okay. So I want to put this into perspective with your younger men. Men, if you're not sleeping well, it will kill you. And it gets worse. It doesn't get better, it gets worse. And even with the sleep study, what was he told? Uh, you're all right. Like, if you want to get a CPAP, you can. So if we don't know what we don't know, it's not a priority to us. I'm like, oh my gosh, you're going to wear CPAP at night? Oh, that's so not hot. And then he's thinking the same thing, because we're like newly dating. And so, yeah, get in the airway hole. And I'm like, okay, you got to do this. But he's been on blood pressure meds for a long time. And the
Wow.
longer you go with your heart working harder, that's what it means. It's taxing your heart out. If you watch somebody sleep that has sleep apnea, it's freaking scary. It's scary. You're seeing their chest, like, if you're listening, but like, you just see that chest cavity, like, working so hard. And imagine doing that night after night after night. That's probably why you had insomnia, because your body's like, I don't want to go to bed again because I'm not going to sleep. I'm not going to breathe well. And
Right.
your brain starts to sense that as a threat. So then you don't fall asleep. Then you have a hard time sleeping. What comes next? Well, we talked about the blood pressure, your mental health. There's not one mental health disorder that does not have an association with sleep disorders. So when we're looking at our world today and we know how our world looks, mental health is right there and we need to address it, but it comes with other clusters, if you will. of comorbidities, and a big one is sleep apnea, upper airway resistance, and sleep disorder breathing. So we had to deal with that. This is around COVID. This started all like getting deeper into his symptoms. And, he's getting, oh, my heart, my heart. And I'm like, oh, you're just anxious because you're going to get COVID. Oh, my heart, my heart. And just like brush him off, brush him off. And then one day he's like getting up from bed and he's like, oh, my heart is just like weird. And then Apple Watch, Apple Watch, man, it was like, you're in atrial fibrillation. You should probably go to the
Wow.
hospital. So
Wow.
I called the hospital and I was like, what should I do? I don't, I'm trained in medical emergencies, but they didn't train us in AFib.
Mm-hmm.
So I took him to the hospital and they couldn't stabilize his blood pressure. They couldn't stabilize his heart rate. I thought he was going to die. And it was horrible. It's horrible. I don't want anybody to go through that. And it's sleep apnea. And it took people forever, what modern science and research knows now, to make that connection that cardiovascular incidences such as atrial fibrillation have everything to do with sleep disorder breathing, oral resting posture, and then we're talking about structure. His cardiologist, when his blood pressure started going down, said, "What are you doing? What's going on?" And we said, "Oh, we're taping his mouth and we're working on myofunctional therapy." And he was like baffled. Like I had 8 snakes coming out of my head. So,
Mm.
oh, tell me more about this. Like you think people know and they don't. You think medical health professionals know the link between oral volume and breathing and sleep. They don't, because the mouth is so separate from the body in medicine. And
Yeah.
there's nobody in charge of this airway thing. There's nobody in charge of it. So my whole deal is, you have a partner that's not sleeping well, you will watch them slowly decline, and you will watch them either mentally decline or cardiovascular decline into having an event that's serious. So now we did, okay, so Vivos. So that's
Mm-hmm.
a similar to a homeo block. It's a DNA appliance, it's acrylic appliance, it's tooth-borne. Back when it first came out, we were all for it because we're like, it's going to help us. Because I did so great with Myo, and I'm a Buteyko certified breathing instructor. So Buteyko, like crazy. Have you done therapy, Cannon?
No, so I haven't done
Okay.
That's one of the reasons I wanted to
I'm like,
talk to you for sure.
do I need to work with you?
Yeah, I'll have to
So
schedule an
because
appointment.
yeah, because I hear that like, not to point that out, but I hear that, and what's interesting is Dr. Mew does the same thing.
That's
When he
funny.
talks, he pulls his air in. But Buteyko also helped me with my public speaking, because you have to cadence your breath
Mm-hmm.
and reserve it. And that helps with people and their attention. But back to my husband. So we did the Vivos, both of us. I had a great response with Vivos. I think I could have done more. And then I'm newly diagnosed with hypermolar Ehlers-Danlos and all the other things that comes with that. So hypermobility, if you're suspected to have that, there's a simple screening you can do. It's called the Baton scale. You you want to do skeletal borne approaches versus tooth borne, alveolar borne, because our periodontal ligaments, boop, relapse. So I feel like I have some relapse and then some asymmetry. So he did better to where he could get off his blood pressure medication. Okay. So that's
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 crazy.
huge. That's
Mm-hmm.
huge. Just from Myo Vivos. And he has a wicked tongue tie. And then what else? Did you do anything else? I'm trying, because we've done so much. Oh, he had his nose done. He has nose surgery, nasal surgery.
Wow.
And I've been doing this a long time. Back then, you weren't it wasn't a discussion of like, hey guys. It wasn't a discussion of like, approach the maxilla and the mandible first and then address the nose. So he addressed his nose. That helped a ton too. And then we didn't have any MARPE providers here in Phoenix, being as that we're such a huge city. So I would refer people to Movahead. I would refer people
Mm-hmm.
to LA for the Breathe Institute. That was as close as we could get. But then I know there's a couple bros here doing MARPE, like Nichols and um, uh, they split up. But anyway, super asymmetrical, just saying, not good. And they go too fast. And so I met Stella on Instagram and
Mhm.
she's like, hey girl, hey, I'm here. And I do have a preference for women providers because we are very type A and we are very detail oriented and we will not push you so fast. And you don't want to do that, right? You don't want asymmetry. You don't want to have neurological impact from expanding too fast, too quick.
Yeah.
So got that on and it, were you in a lot, like how was your pain when you got yours
The
out of
first
10?
the first 3 nights I was wishing I had um more Tylenol codeine or harder meds.
Oh,
I
yeah.
was waking up. I was waking up in the middle of the night, and I did have a bit of a complication where I took Excedrin like the second day or the third day in the
Ooh.
morning, had a headache,
Uh-huh.
and
Uh-huh.
that caused the scab to like come loose, or eating caused the scab to come loose, and then the aspirin and the Excedrin,
Yes.
I was bleeding
You
all
poor
day.
thing. Oh
Um,
my gosh, Cannon.
so the
Ah,
first I was gonna start
ah,
turning, right,
Cannon.
per Dr. Evans'
Hmm.
protocol, twice a day till the split, and then once a day, and then she slows down to once every other day, I believe was my protocol. But I ended up having the expander sit in my mouth for a week, which I feel like was almost better to let it kind of like heal.
Absolutely.
And then I started turning once a day, and then I slowed down to once every other day was mine. But so
Yeah,
yes, pain for sure, lots of pain.
yeah. Yeah. And um, a lot of my women clients don't have that. And that's interesting because I think, we're primed for having babies. And I think we get some hormone protection too. But yeah, like goes to say that he was uncomfortable. He's older, so we have more to move. Bones are denser, bones and ligaments have muscle memory. So there's a lot more oomph that he needs to have. And like I don't hear his nose at all anymore. It's crazy. Like
Wow.
I used to be able to hear the resistance in there. And so that nasal base has opened so wide for him and he's going to get it off next month. At the end of next month he'll have it a year. Where are you at with your timeline?
I had mine installed October 1st, so I actually
Okay, 6
go
months.
I might be having the
Super.
arms removed
Oh,
on
cool. Yeah.
Thursday, maybe. We'll see how it goes.
Yes. Yes. Well, good luck. I hope so. But yeah, that's very similar to him. And he had six, right? Six tats?
Same. Wow.
Six, eight, eight.
8?
He had
Oh,
eight.
okay. Nice. Yeah, well,
Dang.
more dense bone, yeah.
My man had eight screws. Uh-huh. Just kidding. He's like working over there, rolling his eyes. So yeah, he had eight, and then she did piezo cuts.
Okay.
She's brilliant. She's brilliant. But yeah, so then totally like so much better. He's sleeping better. He's still on a CPAP. And the thing is, like, people, if you need a CPAP, get on it. You'll get oxygen to your brain. Like even if you're in interim of like what you should be doing with a device or doing a MARPE or taking the jump, like get oxygen to your brain. You're like turning down oxygen. Like, don't do that. We want
Mhm.
you around. We want you to live. So the CPAPs help, but it's almost like it's too much because he's so wide.
Mm.
And so we have to tighter it and then go back and see the sleep medicine doctor. And who knows, maybe he'll be off it.
Yeah, that's amazing.
So
That's
yeah,
amazing.
it's been like I don't worry. I at night, literally every night, I'm like, I got insomnia because I was waiting for him to stop breathing every single night until I like went and slept more in the other room.
Wow.
And I was like, okay, we got to do something. I can't do this anymore. So it
Mhm.
affects you. It affects your partner that sleeps next to you. It affects your kids because my friend just made a post about modeling cells. Like if you are a dad or a mom or a person that isn't breathing through their nose, isn't sleeping well, this is a great segue into the early intervention. Um, you are modeling bad behaviors and characteristics. I know you probably don't know that, but mouth breathing, low tongue posture, being okay with snoring, saying that sleep apnea runs in the family isn't something that should be presented without having some discretion there, because mouth breathing is never normal, snoring is never normal, sleep apnea is never normal. And when we stop joking about it and we take it seriously, less people will die in their sleep, and less kids will, bless you. Sorry. So bless you again, Pinky. What's wrong with you?
Oh my gosh.
So more kids will get help and not have to struggle with the emotional baggage of bedwetting, of having ADHD type symptoms, and struggling in school, and having emotional breakdowns, and changing the dynamic of families because Johnny's crashing out again because we don't know he has sleep disorder breathing. So when you look at your children, you want to look for anything. And as a parent, you know your kids and you know when something's wrong. I can honestly say that you feel it in your gut, and always trust your intuition. I will always take a parent's intuition over a specialist that they went to that said, oh, don't worry about it. Like, I'm always going to worry about it with the parent. Mouth open posture, even at night. Oh, it's just at night. No, that's wrong. If you see dry, crusty lips all the time, uh, that's not okay. They're probably cracking that mouth open when you're not watching them at night. They're taking Zyrtec, and then I say, oh, what season do they have allergies? How often? Oh, all year round. Okay, well then that's not an allergy problem. That's a nose problem. And that nose problem is going to lead to a sleep problem, going to need to lead to a structural problem. So, mouth open, snoring, dry chapped lips, venous pooling or dark circles under the eyes. That tells me that they're not efficiently nasal breathing. So, we're missing some of that really juicy nitric oxide that helps dilate the blood vessels. We're missing that. Huge cranial torsion issues, cranial asymmetries, if they're syndromic. So, anything really that's a chromosomal abnormality will affect the genome, because the development of the cells of the like the oral system, comes from the brain. And a lot of these genetic disorders will have disruptions in the mouth and the craniofacial complex. So if there's a genetic condition, then they need to start with a therapist, start with somebody like me, a myofunctional therapist. If they're having behavior issues, that's not their norm, like just out of nowhere, I'm almost guaranteed it's going to be a sleep issue. Bedwetting, like we talked about. If it's really hard to get them out of bed in the morning, or vice versa, and they just wake up, he's just an early riser. Well, that's not normal either, especially if it's early rising also on the weekends. I mean, school systems are not set up for good sleep. That's just the truth, but we can't do much about that. And then there's other things. So if they're moving around a lot in bed, you'll notice they'll have bedhead fairy visits every night. Like, why are they moving around so much? Because their body's constantly trying to put them in a better position to get more air through their pharyngeal space and up to their brain and through the rest of their body. If they have a hard time with foods, like denser textured foods like mashed potatoes, meats, that tells me that there's a tongue problem, a swallowing problem, and then we just start opening our mouths. I could go on and on and on, but those are the main ones. Those would be the main ones. And what sticks out to me is you have to be sure, parents, that you're cleaning your kid's nose and learn how to check their nose. So close up a nostril, have them breathe in and out, listen to the airflow, close up the other nostril, have them breathe in and out, listen to the airflow, and then ask your kids where their tongue likes to be comfy cozy, because they'll always tell you right away. Adults will want to tell you the right answer. So kids will be like, it just lives down here on the floor of my mouth. And I'm like, all right, cool, let's work on it, buddy, because we got to get that tongue strong so you can be the
Mhm.
best buddy you can be. And then just make it like fun and inviting. And then our team navigates who else they need. Everybody needs structural help. Like what you're going through now, like most of these kids rolling in are also needing expansion. But if we can get them expanded early, and I had to fight in this town to find somebody to do that because
Mhm.
nobody was willing to. And so we need to keep fighting and spreading the word because these kids deserve our help. We deserve to talk about this more. You deserve it. I deserve it. My husband deserves it. Like this is our
Mhm.
right to breathe and sleep like we should.
Yeah.
So, and that's on expansion. That's
Kelley,
on
that
airway.
that was amazing. That was amazing. All
Thanks,
on
thanks.
Airway. Oh my gosh. We
That's
made
your new
it
shirt, Cannon.
on
That's on
Airway. Yeah.
Airway. I got
When
some
I
Airway type shit.
when I get approved to sell merch on YouTube, that'll be my we'll split the profits on that one.
Okay. My son sells merch on YouTube, so I'll find out
Oh,
how he does
no way. Yeah. Let's do it.
it. Yeah. So anyway, but okay. Well, thank you so much. Like I
This was
know we got stuff to
awesome.
do, but
Yeah, we're
um,
gonna have to come on here again because,
I
like you
know
said, there is so much to go into.
so
And
much.
even while we were talking, I was just like, "Oh, we could go here, we could go there." It's like,
Hmm.
yeah, the rabbit
Like
hole is
this,
infinitely deep.
absolutely. But keep keeping up, Cannon. You're an amazing young man, and I just
Thank you.
hats off to you for doing what you're doing. And I have so much respect for you. So
Thank you.
I'll shoot you a DM, like if you're interested in doing Myo or if you have that in your bandwidth right now.
Mhm.
Absolutely, I'd love to help you. So
Awesome. I'd love to make an appointment. And right back to you with the content and getting the word out there. I mean, your stuff has
yeah,
been
thank you,
great. And it's funny
thank you.
too, like making people
Yes,
laugh is a big part of
yeah,
it because if you're just like staring at the screen and
yeah. I know.
giving, yeah, it's like it gets boring fast. So it's
It's
funny
not fun
to
for me either.
Kelley,
But
thank you
yeah,
so much for joining me on
you
this talk.
too.
Yeah,
Thanks for having me, Cannon. Have a good night.
you too.